topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Tennessee. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. We have got such a great show for you today. I love the show because I literally had LASIK done and was the greatest thing to ever happen to me. And we got so many of your emails asking us to do a show, not only on LASIK, but other areas of eye surgery. And we were lucky enough to find the top ophthalmologist in the state of Tennessee with Wang Vision Institute. And our favorite, I got to tell you, we've gotten so many emails regarding Dr. Jones. Good morning, Dr. Jones.
Good morning. Can you hear me?
We hear you fine. God, you've got a fan club, bro.
Well, that's good.
People, they love the way you explain that you don't talk over their heads and you make it so interesting. And we have an older audience, so cataracts is always big.
Sure.
But what we've learned with Wang is there are so many different areas of ophthalmology. It's not just the LASIK that I had 14 years ago that they told me would only last 10 years. I don't have to wear glasses to read.
Right.
So I'm so glad we have you. Dr. Jones, tell us about Wang Vision Institute.
So at Wang Vision Institute, there's 3 MDs, Dr. Wang, myself, and Dr. Gaduru, and 2 optometrists, Dr. Zimmerman and Dr. Wish. And we basically specialize in vision correction surgery. So we do all of the entire gamut of vision correction surgeries, everything from LASIK, SMILE, ICL surgery, lens replacement surgery for patients once they reach middle age and beyond, and then of course laser cataract surgery. We see general eye exams and take care of dry eye and glaucoma and these various things as well. We're kind of a full comprehensive, what you would call anterior segment practice. So we do a lot of everything within the eye, but our main focus is on vision correction surgery, and we do a lot of those surgeries.
Well, we always kind of discuss with your great marketing director, Heather, what topic we're going to talk about. And I got to tell you, it's like opening up a Christmas present. I never know what new you have. Today, we're going to be talking about ICL procedure, which is implantable contact lenses. And I cannot wait to hear about this.
Sure. Yeah, I mean, ICL, or implantable contact lens, is a very old vision correction surgery. Most patients and most people probably in the general population have not heard of this surgery at all. They have no idea what it is, what it's about. It's actually been around almost as long as LASIK. At Wang Vision, we were one of the first in the state of Tennessee to perform ICL surgery with the original design of the lens. And then over the years, they have actually updated the design of the lens. And the most recent version is called the EVO ICL. And basically the updates in the design of the lens have made it much safer technology. And we were the first in the state of Tennessee to implant that EVO ICL when it became FDA approved a few years ago. So it's a great vision correction procedure. And I love telling patients about it because it's another option. It used to be that we would reserve ICL basically for patients if they weren't a candidate for LASIK, either because their prescription was just too high or their cornea was too thin. There wasn't enough tissue there for us to safely do LASIK. In the past, those would be kind of the only people we would recommend ICL to. But now more and more, I'm telling many patients about ICL, especially if they're high prescriptions that we're correcting, -6, -7, -8, and beyond. It's worth discussing ICL with the patient because studies have shown, and in my clinical experience, this is probably true, the vision quality is actually much better with ICL compared to LASIK surgery. And that just has to do with the shape of the lens and how LASIK changes the shape of the cornea for really high prescriptions. So more and more, I'm recommending it to patients, and our utilization of ICL as our vision correction procedure of choice, it's increasing in terms of percent surgery. It's still a minority because most patients are interested in LASIK, and LASIK is a great procedure, but it's increasing each year, the amount of ICL surgeries we're doing. We have a lot of experience with it and have had really great results.
Well, you do LASIK and SMILE.
Yes.
Why would anyone even want to do LASIK or SMILE with ICL out there?
Well, it's a great question. I mean, I alluded to the fact that a lot of patients have not heard of ICL. So one of our strategies in terms of marketing is to get the word out about EVO ICL, because the reality is probably 95% plus patients that come into our practice have not heard of this technology at all. They have no idea what it is. And the idea of it scares some patients a little bit, the idea of, oh, an implantable lens that you're going to
Right.
hide my eye behind the pupil. Wow, it sounds invasive. It sounds scary. Is it painful? Is it going to be like a long recovery? Am I going to be blind the first few days? What is the deal in terms of the surgery? I've not heard of this. Everybody's heard of LASIK and knows somebody who's had LASIK and is aware of the very rapid results and fast recovery. And so that's a little bit of a challenge. Most patients, if they're otherwise a candidate for LASIK and they want LASIK, we'll certainly do LASIK after educating them on the doing informed consent on the procedure. But the reality is ICL is a great procedure, and a lot of most patients' concerns about the surgery, is it painful? What's the recovery like? Really, your experience as a patient with ICL in terms of the surgery itself and the post-op afterwards, it's basically identical to LASIK in terms of what you experience. You have no pain during the surgery. Both eyes are done on the same day. You're really just looking at a bright light the entire time. The lens is placed behind the pupil. Vision is better immediately after the surgery. You go out to recovery and you can see much better than you did without glasses before. And usually by the next day after surgery, most patients are seeing very, very clearly. They're able to drive. So the recovery in terms of the vision and the post-op restrictions, there's really not much there. It's basically identical to LASIK in terms of the restrictions. The lens is placed into the eye through a very tiny incision on the side of the eye that seals with no stitches at all. There's really minimal discomfort, minimal downtime. So the patient experience with ICL is really good in terms of they're back to work the next day. They're able to drive the next day. They're able to basically resume most normal activities the day after surgery, just some restrictions in terms of exercise and water getting in the eyes and things like that the first week. But it's a really rapid recovery. And I think most patients aren't thinking that when they hear about the procedure. They're thinking it's something really invasive and laborious. And the reality is it's just not. I would put it in terms of invasiveness, it's basically equal to LASIK because actually ICL is reversible. So if there's ever any problem with the lens at all, it's causing any kind of issue with the eye, it can be removed from the eye very safely. It's very easy to do. LASIK is not a reversible procedure. There's nothing we can do if there's, dry eye or issues after LASIK. We're just limited to medical treatment. We can't go back and reverse the surgery we already did with LASIK. So that's another advantage of ICL. It's in my mind, in terms of risk for the patient, it's analogous to LASIK. There's really no difference there. It's just slightly different risks with the ICL procedure.
Well, I'm curious to know why my LASIK has lasted so long.
Yeah,
Because first thing you ask the doctors, how long is it going to last? And they usually say about 10 years.
sure.
And mine, I think I'm going on 15 years now.
Yeah,
I'm reading right now with no glasses at all, which I had to have reading glasses before LASIK. Why do you think mine lasted so long?
Yeah, no, it's a great question. The reality is a lot of patients ask this question is, I'm going to have LASIK. How many years can I
Right.
expect to have good vision? And I tell most patients, LASIK it's a permanent change in the shape to your cornea. So the results in terms of longevity of the treatment, it should be many, many, many years, unless your vision happens to change for some other reason, such as cataract develops. Maybe you develop a little bit more astigmatism with time. That's pretty uncommon. And then, of course, if you have both eyes corrected for distance, in your mid 40s and beyond, you'll start to need reading glasses. Sometimes we do monovision with LASIK to try to prevent that from occurring. But basically, the change in your prescription and the correction you get out of LASIK within that first, week, that you can expect that it should last many years to come. There's very rare situations where the treatment kind of regresses with time.
When you explain to a patient about LASIK, SMILE, or ICL, which one do most choose?
Yeah, it's a great question. Like I said, most patients come into the office having heard of LASIK, and so that's
Right.
primarily what they're interested in. And LASIK's a great procedure. And vast majority of patients who come to see us will be a good candidate for LASIK based on their prescription and the anatomy of their cornea and whatnot. However, when we explain to patients the difference between LASIK and SMILE, which we talked about on a previous
Yes.
episode, SMILE sounds very attractive to most patients, and as it should, because there are certainly very definitive advantages in terms of being a less invasive procedure, SMILE is compared to LASIK. And they're basically identical in terms of how they work. They're both laser procedures that reshape the cornea to correct prescriptions. They're exactly the same in terms of accuracy, longevity of the treatment effect, and how precise the surgery is. So most patients that come to see us end up picking SMILE over LASIK when they hear these advantages. And we've had a lot of great results with SMILE. Very small minority of patients will pick ICL. And it's usually, vast majority of the time, like I said, going to be people, if they're not a candidate for LASIK, their prescription's just too high, too much astigmatism, their cornea is too thin. We offer ICL very strongly and discuss the advantages of this procedure. And vast majority of patients are going to be fine with going with ICL, but that's a minority of patients because most are going to come in interested in LASIK, having heard of LASIK previously.
Is there a ideal candidate for ICL?
Yeah, no, that's a great question. So the ideal candidate kind of in our practice in terms of how we practice is going to be somebody that's basically not a LASIK candidate. And so, like I said, that's going to be generally patients if your prescription is really high, like in the realm of maybe -8, -9 or higher. We see patients every week just like that with super ultra high prescriptions. ICL is very, very good and accurate at correcting those prescriptions. So we offer it to those patients. Other situations might be if the cornea is too thin and it's just not safe to do any type of laser vision correction on the cornea like LASIK or SMILE. We'll offer ICL to those patients as long as their pre-op measurements make them a good candidate for that particular lens. So that's kind of the ideal candidate. But like I said, ICL, it's indicated from prescriptions anywhere from -3 all the way up to like -15, -17. So it's a huge range of prescriptions. And if a patient heard about ICL and they were interested and they came to me with a prescription of -3, -4, and they were a good candidate for ICL, I would certainly be willing to do that surgery because it has results that are equal to, if not sometimes better than LASIK and SMILE.
Wow. What about how does ICL affect things like night vision or dry eye compared to LASIK?
Yeah, that's a good question. So, I mean, in general, ICL is vast majority of the time going to cause less glare and halos around lights at night and less dry eye. And that's because of the shape of the lens implant. It's not changing the shape of the cornea as much as we have to do with LASIK for really high prescriptions. So in general, patients are going to have a little bit better night vision with the ICL over traditional LASIK or SMILE. And it causes less dry eye because it's not a corneal surgery. It's not, there's no incision made like a flap like you get with LASIK, where it severs corneal nerves. That's what causes a little bit of the dry eye symptoms after LASIK. With that, you don't get that with ICL. It's a very tiny 2 millimeter peripheral incision. There really isn't appreciable significant dry eye with the surgery at all. So it has that advantage.
You just got a text from Milton in Nashville. I'm really enjoying your show. I'm 64 years old. I've heard of Wang Vision. Um, how do I know when I need to have cataract surgery done?
Yeah, that's a great question. So basically, it depends on you, the patient's symptoms. So the earliest symptoms that cataract are getting to the point where it may be of benefit to do surgery to remove that and place a lens implant to correct the vision would be if you're starting to have night vision difficulties, just trouble seeing at night, trouble driving at night, seeing a lot of glare and halos around lights from the headlights while driving at night. Some patients with cataract start to have a lot of trouble reading, especially if the lighting in the room is really, really dim. So there's generally patients will start to develop some problems with their vision. And that's how we know that the cataract is possibly getting to the point where you may benefit from surgery, because we can certainly improve those things by replacing that cataract with a clear lens implant. It's not really based on how dense or severe the cataract is. We do surgery for at Wang Vision on cataracts ranging from what appear to be very mild to sometimes super dense cataracts where you can't even see into the back of the eye and all the patient can see is light. So there's a wide range of cataract surgery that I have a vast amount of experience with. It's based on the patient and their symptoms. Some patients come to us late because, you know, they've not really been bothered by their vision until the cataract.
I think Dr. Jones is frozen up. Um, Maybe he can take his mouse and run it around the screen. Hey, this happens sometimes. This happens with a live show. Uh, it's amazing because we're getting all these texts right now. Um, so maybe we'll get him to come back on. He is frozen right now. Hey, listen, that happens with all the big national shows, your Foxes and your CNNs. There are times when it freezes. I'm sure he'll be coming back in because it seems like a lot of the questions that we're getting. Oh, here he comes. It's come
There we
back
go.
in.
Sorry,
That's okay.
difficulty
Hey,
there.
it happens. I was just saying, we're getting all these texts, people wanting to, like, here's one right here from Norm in Nashville. He said, I had LASIK surgery. Um, can I also have late? It's been 9 years. Can I also get ICL?
Um, Generally, the answer to that, if you've had LASIK before, can you get ICL afterwards? Generally, the answer to that is going to be no. And that's because ICL is generally going to be for prescriptions about -3 and above. So if you've already had LASIK, if there is some kind of residual prescription or whatnot, ICL is not going to be in the proper power to really correct your issue. So generally, the answer to that will be no.
So would they have after it wears off after so many years, would they go back in and have LASIK again?
You could potentially have an enhancement in the terms of a LASIK flap relift or PRK, or you could have lens replacement. You could have refractive lens exchange surgery if, for example, you've had LASIK in the past, now you're getting to middle age, mid 40s, maybe you're starting to need reading glasses. What's your option? It's going to be, if you want to reduce your dependence on reading glasses, it's probably going to be refractive lens exchange, laser lens replacement surgery with a special premium lens that we have access to help give near vision. So kind of depends. There could be a few different options depending on what your goals are from the surgery.
Dr. Jones, a lot of people are writing in. I guess maybe they missed the first part of the show. They want to know about the recovery
Yeah.
process with ICL.
Yeah, the recovery process basically is pretty straightforward. After the surgery, you go home and just kind of rest and try to keep your eyes closed. You may feel a little bit of foreign body sensation from the incisions, nothing super significant. Next day, we check you in office. Most patients are seeing pretty clearly the next day. They're able to drive. You can go about your normal activities. You can work on the computer. You can do basically almost anything you would normally the day after surgery. So there's really minimal restrictions. Basically, the biggest ones are going to be no water in the eyes for about a week, and then limiting exercise a little bit, so no sweat or doing anything super aggressive with lifting heavy weights or anything like that for the first week. Other than that, the recovery is really straightforward. There's minimal discomfort, there's minimal downtime. It's basically pretty similar to LASIK in terms of the recovery.
Can they return back to work the next day?
You can, yeah, depending on what you do for work. If you kind of work in like really dusty environment, you work in construction or whatnot, something like that, it might be a good idea to take several days off from work just to prevent any dust getting in the eyes while the incisions are still healing. But yeah, if you work on the computer like most of us do, you can go back to work the next day. Vision might still be a little foggy, so usually I say give the vision a few days to kind of get up to 100% maximum clarity, but it's not going to hurt your eyes at all, and it's totally fine to get to work on the computer the next day. Yeah.
Are there any side effects from ICL?
From ICL, yeah, generally, I tell most patients the biggest side effect, the lens implant, the EVO ICL, it's circular shaped. So there is a little bit of a halo effect around lights at night. If the light hits the eye in a particular way, patients will note kind of seeing almost like a circle of light around really bright light sources. Most patients are not tremendously bothered by it. They notice it. And it tends to get better with time, kind of like the glare and halos you may see with LASIK. Tends to improve steadily as the days to weeks pass after surgery. So that's probably the biggest side effect overall with the ICL. It's not something you can see from the outside. You can't really look at the eye and tell that somebody's had ICL surgery. It doesn't have too much of a reflection or anything like that. So there's no change in kind of the appearance of the eye, really.
Dr. Jones, tell us how can they reach your office to set up an appointment with you?
Yeah, that's a great question. We have a phone number. It's 615-321-8881. You can call, and one of our coordinators will be happy to help set up a consultation to see what surgeries you're a candidate for. We also have a website, which is wangvisioninstitute.com, where you can do the same, book your evaluation online, read a little bit more about all of the different vision correction procedures we offer as well.
Dr. Jones, we're so lucky to have you. We're so lucky to have Wang Vision. You'll be back again with us next month with probably a new surprise, something else that Wang is doing new like you always do. Thank you so much, Dr. Jones.
Thank you, Steve. Thanks for having me.
We'll see you again.
Bye.
That's Dr. Kyle Jones, Wang Vision Institute. Hey, that'll do it for us today. We'll be back again next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.